Agriculture is America's most hazardous occupation, yet work and home are often intertwined on farms, too often with tragic results. Every 3 days, a child dies in an agricultural trauma incident. Dr. Barbara Lee has devoted her career to challenging unsafe traditions that jeopardize the well-being of children who visit, live, or work on farms. It was Dr. Lee's experience as a nurse in a rural hospital in which her passion for agricultural health and safety took root. With a heavy heart and a broad vision for the future, she stepped away from the patient bedside to pursue a PhD and shifted her focus to starting her own research program which would reach countless rural lives, nationally and abroad. Barb helped set the national agenda for childhood agricultural injury prevention. She directed development of a national action plan and influenced federal policy and funding to launch a national initiative on childhood agricultural injury prevention. She chaired major efforts leading to voluntary standards for children's work in agriculture and for protecting non-working children. In 1996, she was voted president of the International Society for Agricultural Safety and Health, the first woman to hold that office. Since 1997, Dr. Lee has directed the National Children's Center for Rural and Agricultural Health and Safety, a part of the National Farm Medicine Center and Marshfield Clinic Institute in Marshfield, Wisconsin. During that time, the rate of non-fatal childhood farm-related injuries has declined by nearly 70% and is one of the CDC's top 10 public health accomplishments of the last decade. In 2007, to ensure that agribusiness leaders and major farm organizations endorse safety interventions, she was instrumental in creating and administering the Agricultural Safety and Health Council of America, a national voice for the safety and health of all workers in agriculture. In all, Dr. Lee has secured more than $18 million in external funding, authored 35 peer-reviewed publications, many book chapters, editorials and commentaries, and participated in numerous media interviews. The accomplishments and issues brought to the forefront by Dr. Lee and the National Farm Medicine Center did not happen overnight, but through her tireless efforts with a skilled, dedicated staff, many unsafe traditions have been challenged, and children living and working on farms have a greater likelihood of enjoying a long, prosperous life.
Thank you, NRHA. It is such an honor to receive your 2017 Outstanding Researcher Award. I'm accepting this on behalf of our entire team at the National Farm Medicine Center and the Children's Center in Marshfield, Wisconsin. Over the years, I've been extremely fortunate to work with a diverse and talented staff that has a sincere respect for the culture of agriculture. And our team is grateful to Marshfield Clinic, which had the foresight to establish the Farm Center back in 1981 and the commitment to keep it going ever since then. So cheers and congratulations to all of this year's award recipients. It's an honor to be here among you. And thanks again to the National Rural Health Association.